I'm Dr. John Waller Del Rosa. I work for UT McGovern as an emergency medicine physician and as a director of quality.
And I'm Dr. Richard Wickoff. I'm one of the emergency medicine critical care faculty at the McGovern Medical School. We're here to talk to you about a new feasibility pilot that we are starting involving ECMO and eCPR.
The goal is to bring extracorporeal CPR, or eCPR, to out-of-hospital cardiac arrests in the Houston area.
ECMO, or extracorporeal membrane oxygenation, is a method of using a pump and oxygenator to replace the work of the lungs and/or the heart. It is a very similar device they use for open heart surgeries to put a patient on cardiopulmonary bypass. Different insertion sites and arrangements exist, but the one that we will be discussing is femoral venal arterial ECMO. By placing large catheters into the femoral artery and vein and connecting them to the ECMO machine, a patient's vital organs can be fully perfused even while in cardiac arrest.
Extracorporeal cardiopulmonary resuscitation, or eCPR, is using an ECMO device on a cardiac arrest patient. The ECMO device replaces manual CPR, both bagging and chest compressions, and is much more effective than traditional CPR at being able to provide near complete perfusion support. This is already being employed in many hospitals for select patients, including Memorial Hermann Texas Medical Center. Patient selection, however, is critical to provide good neurologic survival. Generally, healthier and young people tend to do better, and generally shockable initial rhythms are the most likely to benefit. This is for ventricular tachycardia or ventricular fibrillation.
This allows for faster time on pump and earlier perfusion to the brain and vital organs, buying time. Based on the success of the mobile stroke unit, UT Health has partnered with Memorial Hermann HVI, or Heart and Vascular Institute, and the Houston Fire Department to test the feasibility of implementing this within Central Houston. When a cardiac arrest pages out, ECMO 1 will drive the scene with 2 emergency medicine physicians and support staff. If the patient meets the criteria for ECMO, the team will take over medical control of the scene, drape the patient while the Lucas device continues chest compressions, and with ultrasound, place the patient on cardiopulmonary bypass. Houston Fire Department and the ECMO physicians will package the patient and transport them within the Houston Fire Department ambulance to Memorial Hermann Texas Medical Center Emergency Department.
In summary, the purpose of this eCPR project is to use a heart-lung bypass machine, or eCPR, in out-of-hospital cardiac arrest patients and increase their chance of neurologically intact survival.
Look forward to seeing you all in the field. Thank you for your time.